This is a presentation over the respiratory system. I will make it as short as possible, so we may jump through a couple of slides that do not contain any significant data for us. So, first off, you need to know what the functions of the respiratory system are. It exchanges gases between the blood and the external environment, and the passageways exist to humidify, clean that air as it comes in so that nothing gets down into the lungs that could cause us disease or problem. Now, the organs of the respiratory system are the nose, the pharynx, the larynx, the trachea, the bronchi, the lungs, and the alveoli. And we will talk about each of those in turn. The nose is the external visible part of the respiratory system, and the air enters through the openings, the nostrils or nares, and go into the nasal cavity. Well, within the nasal cavity, we have it divided into a right and left side by the nasal septum, and located on the walls are some structures called concha, which allow the air to get swirled around. They're sometimes referred to as turbinates. Also, within the nasal cavity, we have our sense of smell, and the receptors are located on the superior surface of the nasal cavity, which makes it somewhat difficult for air to actually flow up there. If we take a look here, you can see that this right in here is where our olfactory receptors are. The normal flow of air would be to come through this way, but if we breathe in really hard, draw in a lot of air, we can pull the air up to those olfactory receptors so that we can smell a little bit better. The rest of the cavity is lined with respiratory mucosa, its purpose to moisten the air and trap incoming foreign particles. The walls, again, we have those lateral projections called concha. They increase the surface area, increase air turbulence within the nasal cavity so that any material that comes in can stick to the mucus. Additionally, this allows us to warm the air. The nasal cavity is also separated from the oral cavity by the hard palate and the soft palate. The hard palate's the bony part that you can feel toward the front of your mouth with your tongue. The soft palate is muscle and tissue which closes off the nasal cavity when we swallow so that materials do not go up instead of down. Located in other areas in our skull are paranasal sinuses, and these sinuses are located in the frontal bone, the sphenoid, the ethmoid, and the maxillary bone. You should know which bones have these because one possible test question is which bone does not contain a paranasal sinus. Now, the purpose of these sinuses is to lighten the skull. They also act as resonance chambers for speech. If any of you have played a guitar, a solid body guitar, like an electric, doesn't make any sound hardly at all without amplification. But a hollow body guitar, an acoustic guitar, resonates very nicely and has a good full sound. Additionally, these tissues produce mucus, which drains into the nasal cavities. Some of the nasal cavities, and you can't see a lot of them, but there is one sinus here, the sphenoid sinus. We have the frontal sinus here. We also have a maxillary sinus, which extends over the teeth, the posterior teeth. This particular sinus does give us some problems because when you get a cold, sometimes the mucus will pull in that sinus and end up giving you what feels like a toothache. Now, The passageway for air after it has gotten out of the nasal cavity is to go down the pharynx. And we've talked about the pharynx before as relates to the digestive tract. The nasopharynx is the part that is just the nasal cavity. I'm sorry, just behind the nasal cavity, and it's for the flow of air only. Now, the oropharynx and laryngopharynx, these are shared between the digestive tract and the respiratory tract. So they are common passageways for food and air. Now, since both digestive and respiratory are on this upcoming test, that's a good question. Kind of compare and contrast as to what is a common passageway for air, what is and food, what is only a passageway for air, so forth. Now, let's see. The structure of the pharynx, there are a couple of things. There are tubes, pharyngotympanic, also termed eustachian tubes. And what they do is they allow the equalization of pressure within the middle ear. We also have tonsils. We have pharyngeal tonsils, which are the adenoids. And if they get too large, then they can block flow of air out the nasal cavity, and people can kind of have a strange sound like that, which is often referred to as being adenoidal. The palatine tonsils, they say palatine, but they're actually located on the side of the throat. The lingual tonsils are at the base of the tongue. Now, all of these are part of our lymphatic system, our immune system, and they exist to protect us from all of the things that we breathe in, and hopefully act as a gateway for our immune system to protect us from getting very sick. Again, a view of the upper respiratory system, and you can see the palatine tonsils, which are really on the side of the throat, the pharyngeal tonsils located way up at the top of the throat, and the lingual tonsils located down at the base of the tongue. Going to our next slide, and we get into the larynx. The larynx is where we end up splitting from the respiratory tract and the digestive tract. And the larynx routes the food into the proper pathway. It also contains our vocal cords, which allow us to speak, and it is made up of hyaline cartilage with some flaps of elastic cartilage that closes over the trachea when we swallow, so that food doesn't go down the wrong pipe. Now, within the larynx, there's the thyroid cartilage, which is the largest of the cartilages, and that's what we see as the Adam's apple. Now, estrogen stops the production of cartilage in females, whereas the testosterone enhances it, so men have a larger thyroid cartilage, and thus we have longer vocal cords, which results in a deeper voice. Also in this structure, we have the epiglottis, which is on the larynx, and when we swallow, the epiglottis is this little flap of tissue that raises up and forms a lid to cover the larynx. And if we take a look here in a moment, we'll see a picture. But we have vocal cords, and their purpose is just to vibrate and create sound when we speak. We really don't need to know much more about the structure of the larynx, other than that it is associated with speech, and that the opening between the vocal cords is referred to as the glottis. And if you take a look here, you can see that we have the esophagus, where food travels, and we have the trachea. So when we swallow, muscles lift this area up, and that flap closes over so that food will not go down into that part of the throat. I think we've all had something go down the wrong pipe at one time or another. The trachea, uh, that becomes the sole pathway for air. No food goes down here, so this is not shared. It's a 4-inch long tube, and it connects the larynx to the bronchi. It's also reinforced with C-shaped cartilage, and it's the shape it is. Those cartilages are the shape they are, so that when we swallow, the esophagus can actually move into the trachea just a little bit. It's lined with ciliated mucosa, which beat constantly uh, in the opposite direction to bring any dust and other debris out of the lungs. Now, as you can see, here's our structure. You see the C-shaped cartilage, the esophagus behind, so when we swallow a big bolus of food, it kind of squeezes in just a little bit into the trachea. And here we can see cilia, and this material here we see is the mucus. Now, the trachea branches into a left and a right branch, which are our primary bronchi. These are the divisions of the trachea. The right one is a little wider, a little shorter and straighter, so if something goes into the lungs, it's more likely to go into the right lung. Bronchi are divided progressively smaller, and we're going to see the sequence here, but we go from bronchi, actually primary bronchi, to secondary bronchi, to tertiary bronchi, to bronchioles. Ultimately, we get to tertiary bronchioles, and then alveolar sacs, and so forth. I will give you the complete sequence directly. But for the moment, what we need to know is that the trachea comes down and it branches into a right and a left at the primary bronchi. And this image shows, again, the right and the left bronchi. Now, the secondary bronchi go into the different lobes of the lung. Lungs themselves occupy most of the thoracic cavity. The central area between the lungs is where the heart is, and it's in a structure called the mediastinum or mediastinum. The lungs, the apex is the upper part, and it actually comes up very close to along the sides of the neck, whereas the base rests on the diaphragm. That is the portion that, or one of the muscles that allows us to breathe. Now, I don't care how many lobes we have, left lobe, right lobe, but we do get our secondary bronchi, one going into each lobe. So here's our structure, our location of the lungs, our diaphragm, and as you can see, the lungs are up very high into the neck. Known a few people who, well, actually, I have had severe enough coughing fits sometimes that this area up in the neck was actually sore. Now, the lungs have coverings externally. This is a serosa, that is, it has serous fluid, and there is a pulmonary layer that covers the lung surface and a parietal layer that lines the walls of the cavity. And between there, we have fluid that allows the lungs to glide, and it also allows us to breathe. And I will explain that in our next presentation.